So guys, let's now start with the pharyngeal wall. As I said, these are kind of overlapping topics with the ENT. So we'll be taking care of the anatomy part of the pharynx and the larynx. In the pharynx, what is more important is the pharyngeal wall and especially the constrictor muscles. That what are the structures passing between constrictor muscle. So let's build toward that part. Now, starting with first of all, what are the layers in the pharyngeal wall? So there are 4 layers in the pharyngeal wall. If you start from inside to outside, the innermost layer is the mucous membrane. Then we got a fascia that is called as pharyngobasilar fascia. Followed by the thick muscular coat. And then we have fascia outside, that is buccopharyngeal fascia. So there are 4 layers in the pharyngeal wall when we go from inside to outside. As I said, the innermost layer, that is mucous membrane. Outside mucous membrane, that fascia is the pharyngobasilar fascia. That is pharyngobasilar fascia. Then we got the muscle coat. We have a circular muscle and longitudinal muscle. So the muscle coat is there. And then we have this fascia which is outside, that is buccopharyngeal fascia. That is buccopharyngeal fascia. So mucous membrane, pharyngobasilar, muscle coat, and buccopharyngeal fascia. Now this pharyngobasilar fascia on the posterior aspect, there is a thickening. There is a longitudinal thickening of this pharyngobasilar fascia, and that is called as pharyngeal raphe. That is the pharyngeal raphe. So please remember, it's the pharyngobasilar fascia which on the posterior wall will form a linear thickening, and that is called as pharyngeal raphe. What is the importance? This pharyngeal raphe is actually the common insertion. It is for the common insertion for constrictor muscles. It is a common insertion for all the superior, middle, and inferior constrictor muscle. They have a different origin. I'll talk about those origin also. They will have different origin, but when they come posteriorly, this is attached to this one line that is called as pharyngeal raphe. What about muscle coat? We said we have a very thick muscle coat. So there are 2 types of muscle that we have in the pharynx. So we got 2 types of muscle. We got the longitudinal muscle and the circular muscles. So we got the longitudinal muscles and the circular muscles. We have 3 longitudinal muscle and we got 3 circular muscle. Now, if I may ask you guys, which one is outer, which one is inner? I mean, do we have an inner longitudinal or inner circular muscle? Now, maybe few of you must be saying that we have an inner circular and outer longitudinal, which is true from esophagus till anal canal. Everywhere you see in the GIT, we have the circular muscle is inside and longitudinal is outside. Like Taenia coli is made up of the longitudinal muscle and it is on the outside wall of the large intestine, but not in the pharynx. Pharynx is the place where we have the circular muscle present outside. The constrictors are outside and all the longitudinal muscles will be seen inside. They are all in. So longitudinal muscle, which are 3 in number. One is the stylopharyngeus. We got palatopharyngeus. And then we have muscle which is coming from the auditory tube, that is salpingopharyngeus. Salpingopharyngeus. So all these muscles are present inside. So longitudinal muscles, we said they are inner, and circular muscles are outer. It is written INO, inner longitudinal and outer circular muscles. And another important thing about this longitudinal muscle, if you look at the name of the longitudinal muscle, they are actually telling that where they are originating from. I mean, obviously, stylopharyngeus will originate from the styloid process. Palatopharyngeus will come from the palate and palatine aponeurosis. And salpingopharyngeus will come from the auditory tube, from the medial end of auditory tube. So the origin is hidden in their name only, the stylo, palato and salpingo. And they have a common insertion also. Like we said, all the constrictor muscles, they will insert to the pharyngeal raphe, not the longitudinal, circular muscle. Longitudinal muscle of pharynx, they are all inserted to the posterior border of thyroid cartilage. So let us say if this here is the thyroid cartilage, if this is a thyroid cartilage, so all these longitudinal muscles, they will come down and they get inserted onto the posterior border of the thyroid cartilage. Salpingo, stylo and palatopharyngeus muscle, they will all come down and they insert on the posterior border of thyroid cartilage. And this is actually laying the foundation for that longitudinal muscle will come to this thyroid cartilage. Thyroid cartilage is connected to what? Cricoid cartilage. And something we already discussed, guys, cricoid cartilage was connected via ligament of Berry, and that's how it is suspending the thyroid gland. Remember, we said thyroid gland move with the deglutition, and that is because of what? We have a pretracheal layer which is present around the thyroid gland. There is an extension of the pretracheal layer called as ligament of Berry that is attached to cricoid, cricoid to the thyroid, and thyroid posterior border is receiving all the longitudinal muscle. So every time these longitudinal muscle will contract, it will pull the thyroid cartilage, cricoid, and along with the ligament of Berry, the thyroid gland as well. Whereas the circular muscles, there are three circular muscles. We said the three constrictors. We got a superior constrictor, we have middle constrictor, and we got the inferior constrictor. And the inferior constrictor, there are two parts of inferior constrictor. Now, one is thyropharyngeus. One is thyropharyngeus, and the one part is the cricopharyngeus part. Let's talk a bit more about that. Thyropharyngeus and the cricopharyngeus. Insertion, we already know, all the circular muscles are inserted to the posterior onto the pharyngeal raphe. So we got three constrictor, and we have a thyro and the cricopharyngeus, two different parts. Now, before we talk about the thyro and the cricopharyngeus, I hope you remember from the nerve supply, we said all the pharyngeal muscles are supplied by VAC except two. Now, one is stylopharyngeus, which is supplied by the glossopharyngeal nerve, that is different. And one we have this cricopharyngeus, which is supplied by recurrent laryngeal nerve. Supplied by recurrent laryngeal nerve. So, barring these two muscles, stylopharyngeus by glossopharyngeal nerve and cricopharyngeus by recurrent laryngeal nerve, rest all the muscles here are supplied by vago-accessory complex. That is all supplied by VAC. That is vago-accessory complex, or you can say cranial accessory via vagus. Telling you a bit more about the thyro and the cricopharyngeus. See, thyro and the cricopharyngeus, they both are the part of inferior constrictor. So let us once again say this is a thyroid cartilage, and here we got the cricoid. What we already know that the common insertion for all the circular muscle is this raphe, that is the pharyngeal raphe. That is pharyngeal raphe. On the thyroid cartilage, there is a line called as oblique line. There is an angulation on the thyroid cartilage that is called as oblique line of thyroid cartilage. Very important regarding the attachments on the thyroid. I'll tell you more about this in the larynx part. So from this oblique line of thyroid cartilage, you will see the origin of thyropharyngeus muscle. Now look at this, guys. Thyropharyngeus upper fibers will go obliquely like this, overlapping inferior constrictor, middle constrictor, whereas the lower fibers are more or less horizontal. So this muscle here is the thyropharyngeus muscle. Whereas the muscle coming from the lamina of the cricoid cartilage, that is cricopharyngeus muscle. So you are looking at the two part of inferior constrictor. One is thyropharyngeus and one is cricopharyngeus. Now, if I just may write in short here, that is thyropharyngeus. I'm writing TP here, and that is cricopharyngeus with a different nerve supply. Now, attributed to the different nerve supply, different attachment. Now, we do have a potential space or a zone of weakness between the thyroid and the cricopharyngeus, and that zone of weakness, that gap in between, is called as Killian's dehiscence. That is called as Killian's dehiscence. And this Killian's dehiscence is the site for the Zenker's diverticulum. So if there is any neuronal incoordination between the thyropharyngeus and the cricopharyngeus, it will give rise to this diverticulum between the thyroid and crico from the Killian's dehiscence called as Zenker's diverticulum. And this Zenker's diverticulum, please also note, is seen in which wall of the pharynx? Now, it is present in the posterior lateral wall of the pharynx. It is present in the posterior lateral wall of the pharynx. Now, when you say exactly posterior, that is also not correct because we have a raphe behind. Laterally and anterior not possible because we have cartilages. So the diverticulum will not be through the cartilage. So the only exposed part is like on the side of the raphe. So that is posterior lateral. So this diverticulum usually protrudes out from the posterior lateral wall of the pharynx. From the posterior lateral wall of the pharynx. So this is about the inferior constrictor. Now let me tell you, talk about all the three constrictor muscle, because what I said in the pharynx, the most important question is what are the structures passing between the constrictor muscles. So let me use a picture here, atlas image, and where we can understand that how the constrictor muscles are arranged. We'll understand their attachment, the origin and the insertion, and then we will try to find out that what structures will be seen or expected to see between all these muscles. So let me take you to this picture here. Now this is a picture which is showing you about all the three constrictor muscles. Now look at that. This is it's a two different view I'll be using. So first let me talk about this image where you can see it from the side and the three constrictors can be very clearly appreciated. This is the superior constrictor here, that is middle, and here we got the inferior constrictor. Now their attachments are very important, guys. Superior constrictor muscle, look at this. It is attached from this plate, that is a medial pterygoid plate, and the raphe and this hamulus called as pterygoid hamulus. The medial pterygoid plate in the lower part is having a hook-like projection, and that is called as hamulus. So pterygoid hamulus, this one. From this pterygoid plate to the mandible, that is a raphe, and that raphe is called as pterygomandibular raphe. As the name says, pterygo to the mandible, pterygomandibular raphe. So origin of the superior constrictor is from where? It is from the medial pterygoid plate 1, is from pterygoid hamulus 2, it's from pterygomandibular raphe 3, and it is from the most posterior part of mylohyoid line. Inside the mandible, I mean we are seeing it from the outside, inside the mandible there is a line inside, and that is called as mylohyoid line for the origin of mylohyoid. So the posterior part of mylohyoid is giving origin to the superior constrictor muscle. Look at middle constrictor. Middle constrictor muscle can be seen originating from the greater cornua, from the lesser cornua, and also from the lower part, or I should say the lowest part of this ligament, that is stylohyoid ligament. So it is originating from both the cornua and also from the stylohyoid ligament. Whereas inferior constrictor we just discussed. This is an oblique line of thyroid cartilage which is giving origin to the thyropharyngeus, and the lamina of the cricoid cartilage is giving origin to the cricopharyngeus. And insertion for all these muscles is common, and that common insertion is the pharyngeal raphe. That is a pharyngeal raphe, which is a common insertion at the back. So I want you to just first draw the origin and insertion of this muscle, because I believe this is an important attachment to know. The constrictor muscles. Everything about constrictor is important. So let's talk about the attachment first. So this is how we'll go. This is the base of the skull, and let's say this is the pterygoid plate you're looking at here. This is the raphe posteriorly where all the constrictor muscle will insert. Let me just draw it more thicker here. This is the pharyngeal raphe. So that's a pterygoid plate you're looking at. And here we got the mandible with the mylohyoid line on it on the medial aspect. And that's the raphe, pterygomandibular raphe. So that's the first muscle, superior constrictor. That's how the superior constrictor muscle will originate. Pterygoid hamulus. Pterygomandibular raphe. Mylohyoid line. These are the major origins we are talking about of the superior constrictor. That's a major origin of superior constrictor muscle. You'll realize the importance of why I'm talking about the attachment of these muscles. Laryngeal muscle and pharyngeal muscle, they're very important. I mean, you get questions on the muscle, so you should know about everything about these muscles. Then we have the middle constrictor muscle, which is originating from the hyoid bone. So if I put the hyoid bone here, that is the greater cornua. Here's the lesser cornua. And attached to this lesser cornua is the ligament that is stylomandibular ligament. So middle constrictor muscle will originate from this ligament and will go something like this. It is coming from the ligament, from the greater cornua as well as from the lesser cornua. There is a middle constrictor muscle. It is partly overlapping the superior constrictor. They're all like a disposable coffee cup. They're one inside another. So this ligament here is the stylohyoid ligament, and these are the cornua, that is lesser, and let me write here only, and also from the greater cornua. There is no space to write there. That muscle is middle constrictor. Whereas the inferior constrictor muscle, we said it is coming from the, having two parts, one is from the thyroid and one from the cricoid cartilage. So once again, if I sketch this thyroid cartilage here, there is a cricoid, that's the oblique line. Here we got the muscle overlapping. That constrictor here is the inferior constrictor with its two parts. I'm not separating at them at this point. This is the thyroid and the cricopharyngeus from the oblique line of thyroid cartilage and also from the lamina of the cricoid cartilage. The three constrictors. Oblique line of thyroid, and this obviously is the cricoid cartilage. The point is, if you look at all these three constrictor muscle, they are like overlapping each other. This is superior constrictor muscle, which is overlapped by the middle constrictor muscle, and middle is overlapped by the inferior constrictor muscle. And in doing so, you can see there are some potential spaces which are present in between. And those potential spaces, when they overlap each other, are allowing certain structure to go inside. If anything has to go inside the pharynx, it need to go through the constrictor muscle because they are present outside. Now, one important space, guys, here is the space that you see here. Between the base of the skull and superior constrictor, there is a space here, and this space is covered with the fascia. The fascia is called as pharyngomandibular basilar fascia. The fascia is the pharyngo-basilar fascia, and this pharyngo-basilar fascia, the space here which is covered with the pharyngo-basilar fascia, guys, this space is called as sinus of Morgagni. That is called as sinus of Morgagni. Remember, foramen of Morgagni is in the diaphragm. That is foramen of Morgagni. This is sinus of Morgagni. It is a space between the base of the skull and superior constrictor through which certain structures are going in. And let me clarify you one term here, the pharyngobasilar and the buccopharyngeal fascia. Remember, we said the one which is outside the pharyngeal wall is buccopharyngeal because it is covering the buccinator muscle as well as pharyngeal muscle, the superior constrictor muscle. Now, again, it will be very nice if I show you the same picture once again. Look at this, guys. This here is a superior constrictor originating from where? Pterygomandibular raphe. And this one here is the buccinator muscle, also originating from where? From this pterygomandibular raphe. So if I have a fascia covering both these muscles from outside, so that fascia will be called as what? The buccopharyngeal fascia, covering the buccinator muscle that is in the buccal region and then going behind and also present around the pharyngeal muscle, the buccopharyngeal. Makes sense? Look at this one. This is the sinus of Morgagni. Look at this whitish fascia in between. That is a pharyngo-basilar fascia. The fascia is inside the pharyngeal wall, inside the muscles of the pharynx, and then it is going to the base of the skull. Pharyngo-basilar fascia. Pharyngo-basilar, from the inside the pharyngeal muscle and then to the base of the skull, the pharyngo-basilar fascia. If you look at all these constrictor muscles from the posterior aspect, now this is one what we are seeing it from the side here. So we said all the muscles will come behind and they will insert to one common raphe, that is pharyngeal raphe. So look at this. It's a wonderful picture showing the same. So this is the image which is telling you about again the constrictor muscle and showing how they are overlapping each other. Now this is a view from the back. It's a coronal section and imagine you are seeing it from behind. So this here is a superior constrictor muscle. Look at this superior constrictor of the right and the left side. They are coming and meeting at this raphe. That is a middle constrictor muscle overlapping it, meeting at the raphe. And inferior constrictor muscle again meeting at the raphe and overlapping what? Middle constrictor. All overlapping each other. This is pharyngo-basilar fascia. You can see that is pharyngo-basilar fascia. And as I said, there are some pockets which are formed in between. So you will find some structures entering here through this fascia. Some will go between superior middle, some below middle and inferior, and some will be seen below inferior also. And that's what the question is, that what structures are seen passing between the constrictor muscles. Let us again try to apply some logics here rather than just mugging up the structures in between. So don't write anything because I'll draw it for you again. Just look at this, guys. Let's try to understand that what structure should be there in between the constrictor muscle. Between superior and middle constrictor, now can you see a muscle over there? Now this is a stylohyoid ligament. So from the same styloid process, the muscle of the pharynx is also coming, and that muscle is stylopharyngeus. And as I already said, the longitudinal muscles are inside. So you can see it is going inside the pharyngeal wall, and how? By passing between superior and middle constrictor. That means one structure between superior and middle is what muscle? That is stylopharyngeus. Now you also know that stylopharyngeus is the only muscle supplied by what nerve? The glossopharyngeal nerve. So obviously that twig of the glossopharyngeal nerve needs to go inside to supply the same muscle. So guys, between superior and middle constrictor there are two structures. Muscle is stylopharyngeus and the nerve has to be the glossopharyngeal nerve. The glossopharyngeal nerve will go inside. Come below. Now middle and inferior constrictor. What is clearly seen from the picture is that middle constrictor is to the hyoid bone and inferior is to thyroid cartilage. And between hyoid bone and thyroid cartilage, the membrane is what? Thyrohyoid membrane. If you remember the cranial nerve part, remember we said there is one nerve which is piercing the thyrohyoid membrane and going inside. And that nerve is the one which supplies the mucosa of the larynx above the vocal cord. What was that? That was internal laryngeal nerve. So you will see one nerve entering inside and that nerve will be internal laryngeal nerve. Internal laryngeal nerve is supplying the mucosa of the larynx where? Below or above the vocal cord? Above the vocal cord. So there has to be an artery which is supplying it above the vocal cord, and larynx is supplied by the two set of artery. Above the vocal cord, it is superior laryngeal artery. Below the vocal cord, that is inferior laryngeal artery. The straight it goes. Superior laryngeal artery branch of superior thyroid. Inferior laryngeal branch of inferior thyroid. Simple and straight. That means thyroid membrane is pierced by two structure. Artery is what? That is superior laryngeal artery. Nerve is what? That is internal laryngeal nerve, and they are the structure between middle and inferior constrictor. Below inferior constrictor, that is between trachea and esophagus. That is esophagus here, that is trachea. So between trachea and esophagus, you will again see one nerve and one artery, just like we have one artery, one nerve here. And these nerve and artery are responsible for supplying the larynx below the vocal cord. So what is a nerve below the vocal cord? That is recurrent laryngeal nerve. So that is a nerve. And artery we said is what? That is inferior laryngeal artery. That was superior laryngeal. This is inferior laryngeal artery. So what I'm trying to say here, that out of the four spaces that we have, these three spaces can easily be justified. Now say it again. Between superior and middle, what is a muscle? Stylopharyngeus. Between middle and inferior, think of thyroid membrane. So what should be the nerve? That is internal laryngeal nerve going inside. With what blood vessel? Superior laryngeal vessels. Below inferior constrictor, what is there? Tracheoesophageal groove. What is a nerve? What is a blood vessel? Nerve is a recurrent laryngeal nerve. Vessel is inferior laryngeal vessels. So the only thing left here is this gap, and that is a sinus of Morgagni, which we need to remember. The structures passing through this sinus of Morgagni. So let's put it in a more schematic way. The structures passing between the constrictor muscle. Structures between constrictors. So I'm going with that same coronal section, guys. Let's say we are seeing it from behind, and just let's just try to draw it very easy and schematically. If this line here indicates the base of the skull, here is the raphe, that is pharyngeal raphe. That is pharyngeal raphe. And then we have three constrictor muscle. If I just draw them schematically, this is a superior constrictor, you've got a middle constrictor, and let's say this is the inferior constrictor muscle coming down. The superior constrictor muscle toward the raphe, middle is also coming toward the raphe, and so is the inferior constrictor. They're all converging toward the raphe. Try to write it on this side so that the diagram is not spoiled. And we also said that between the superior and the middle constrictor, we have this sinus of Morgagni. There is a sinus of Morgagni. I don't have to write it again. That is sinus of Morgagni, where we have pharyngobasilar fascia. So what is there between the base of the skull and superior constrictor? That was the only space we didn't discuss. Now, one you will see here is the passage of auditory tube, guys. So one structure which is seen here is the auditory tube. Then you also see a muscle which is originating from the auditory tube and going in, and that is levator veli palatini muscle. Not tensor veli palatini, not salpingopharyngeus. The muscle passing through the gap is levator veli palatini, and the two blood vessels will also be seen here. The two blood vessels will be also seen here. So this is something you got to remember. This is the eustachian tube or auditory tube, number one. The muscle which you see originating from the auditory tube, that is levator veli palatini. And then we got these two blood vessels. Now, one is the ascending palatine artery. Remember ascending palatine artery? Don't get confused with that. Ascending palatine artery was a branch of facial artery. STAG, S-T-A-G, 4 branches of the facial artery in the neck. Submental, tonsillar, and A is ascending palatine. So it's a branch of facial artery. Ascending palatine artery, it's coming from facial artery. And then we have a direct branch from ascending pharyngeal artery. This is called as palatine branch. Palatine branch of ascending pharyngeal artery. So just be careful about ascending palatine and ascending pharyngeal. Ascending pharyngeal, you already know it is one of the medial branch of external carotid. So these are the structures which are seen between the base of the skull and superior constrictor. Auditory tube, levator veli palatini, ascending palatine artery which is branch of facial, and palatine branch of ascending pharyngeal which is coming from external carotid. The rest of the spaces, you know it. Between superior and middle constrictor, the muscle is what? Stylopharyngeus. Coming from styloid process, and its nerve, that is glossopharyngeal nerve. Stylopharyngeus, and the nerve is the glossopharyngeal nerve. Between middle and inferior constrictor, you just have to think about what? That is the structures piercing thyroid membrane and supplying the mucosa of the larynx above the vocal cord. So one nerve, one artery here. Similarly, one nerve and one artery below the inferior constrictor in the tracheoesophageal groove. So nerve here is the internal laryngeal nerve, and the vessels will be the superior laryngeal vessels. Whereas below, and as I said, you better also remember them, these are the structures piercing thyroid membrane. They are piercing thyroid membrane. Whereas below we have a recurrent laryngeal nerve to be seen with inferior laryngeal vessels, the structures which are present in the tracheoesophageal groove. Another way of asking the same question, the structures in the tracheoesophageal groove. So these are the structures which are present between the constrictor muscle. That's a very, very commonly asked question from the pharyngeal wall, the structures between the constrictor, and especially the sinus of Mogagni, or you can say the structures which are piercing the pharyngobasilar fascia. Auditory tube, levator veli palatini, ascending palatine artery, and palatine branch of ascending pharyngeal artery. Just don't confuse those arteries there. The last two, we are looking at the superior, as I already said, just to remind you once again guys, superior laryngeal and inferior laryngeal. Superior laryngeal and inferior laryngeal. Superior laryngeal vessel or superior laryngeal artery is a branch of superior thyroid. Inferior laryngeal artery is a branch of inferior thyroid. It is as simple as it goes. Superior laryngeal branch of superior thyroid, inferior laryngeal branch of inferior thyroid artery. So this is about the structures passing between the constrictor muscles.